Speaker, let us take a moment to think about the Isidameni victims and their families who have suffered a terrible and unnecessary loss. Today we must commit to confront this tragedy head-on, to face up to the suffering of the most marginalized and vulnerable members of our society. We must face up to the 102 South Africans and counting who are beyond hearing our apologies and hearing our lamentations of regret. We must do so because we cannot allow this to happen again. We must do this and demand justice. Speaker, the quality of a minister may be measured by how he or she responds to a crisis. As soon as he learned about the Isidameni deaths, Minister Motsoaledi responded immediately, and he appointed the Health Ombudsman, Dr. Malagapuru Makgoba, to investigate and to report, which was released recently, and this report is a model of exactitude. But Speaker, it was too late, and as a result of which there are 102 preventable deaths of the most vulnerable citizens of our land. Dr. Makgoba rightly fingered Gauteng Health as primarily responsible for frontline management failure, but there is a deeper chronic failure of surveillance, of communication, and of emergency response capability that afflicts the health system from the bottom right to the top of Minister Aaron Motsoaledi himself, which is why the DA called on President Jacob Zuma to appoint a judicial inquiry to get to the bottom of it. The question to the minister is this: why were you, one of the most powerful, influential and alert individuals in our land, not aware of this unfolding tragedy when it happened? It took the DS Jack Bloom to extract the mortality figures from MEC Kodani Mashlangu as if they were state secrets. The Director General of Health, Precious Matsoso, knew there was a serious problem in January 2016, but after the court order in favor of Gauteng Health, she actually let the issue go when she should not have. Why is it that DG Matsoso or you did not make it your business to find out what was going on? Speaker, I would like to remind the House about the gravity of this tragedy. Listen to the testimonies taken from the Ombuds report. Here's one. Some NGOs were like concentration camps, overcrowded with unkempt and hungry patients suffering from severe weight loss. There was no food to feed patients because Gauteng Health Department took 3 months to pay. At Mosego, people had no clothes. Patients were left dirty and poorly groomed. Corpses had unexplained bruises on their bodies. Some relatives did not know where their relatives were, and some do not know to this day. Post-mortems were not done. Where most deaths occurred, facilities lacked appropriate health professionals. Madam Speaker, what is to be done? The Ombudsperson made 24 recommendations, of which the Minister has completed a few, and as we heard today, he is busy with more in what is a work in progress. But our efforts must radiate wider than the Ombuds recommendations, critical as they are. More must be done to ensure that the vulnerable are protected in our country. First, our country needs a responsible and alert health leadership across all spheres of society and of government, resting on what is known as a real-time disease surveillance system. As soon as there's a problem, and as soon as there is a death, it must show up in an objective national system of surveillance. This requires the rapid establishment, as the Minister knows, of the National Public Health Institute of South Africa, which has been delayed for much too long and is still being delayed. Second, legislation must be changed so that the Office of Health Standards Compliance may proactively inspect all health facilities as well as all para-health facilities provided for health service use. Third, Minister Motsoaledi complains about the lack of timeous legislation, amending the arcane Inquest Act of 1959, for example, but his own ministry is the laggard in pushing forward new amendments to legislation. Fourth, the position and responsibilities and lines of accountabilities of members of executive councils, the provincial MECs, should be made more strictly and clearly in terms of its subject matter. First, there must be explicit performance requirements. Two, there must be transparency of operation. You cannot have an MEC say, this is the number of deaths, only and operating like she's sitting in a dentistry where it takes the extraction of teeth to get at numbers. It cannot be so. It must be transparent. Together with reporting systems aligned to performance requirements. Third, there has to be unconflicted compliance on MEC's part to the law. And fourth, there must be unconflicted accountability to the job at hand. Fifth, Health Director General Precious Matsoso recommended rightly that a Chief Medical Officer position be created in the National Department of Health. Sixth, the human resource qualifications architecture must be reviewed to ensure that health professionals are not amateurs run all of our health facilities. Seventh, Minister Motsoaledi must use the power he has of legally withholding conditional grants more effectively to exact compliance with provinces that honor our national health laws as long as they do not compromise access to health. Minister Motsoaledi pussyfoots too much around ANC intra-party sensitivities in the province. He must stop pussyfooting around that. Minister Motsoaledi's default reaction to provincial problems is to pull issues back into an overburdened National Health Department. He should remember that mental health was under the National Department till 1999, and it was not a good story. Provinces absorbed the mentally infirm at the time of what's known as deinstitutionalization. How, may we ask, will the National Department run mental health services at a primary care level, at a community level, at a step-down level, and at the hospital level? Remember, the human resource portfolio for health sits in the province, not in the National Department. The DA believes that mental health should be integrated with general health care and catered for all spheres of care. Speaker, I asked Minister Motsoaledi in committee when he first learned of the unfolding Esidimeni tragedy, when others below him, as well as Section 27, already knew. He did not say. So I asked him that question again. Tell me, when did you first learn about the unfolding tragedy? But I asked two more questions today. Tell me why it was so late in the process. What is your diagnosis? And how would you suggest we, as well as you, live as a nation with this tragedy? For today, those who died bear on our conscience, and we stand before you, the dead, in your silence, with your families and relatives in shame. I thank you.